1/3 of humanity, nearly 2.5 billion people, is now locked down. What was once dystopian fantasy is made flesh. From the Prime Minister this morning, the simplest possible message in a letter that will go to every household. You must stay at home. What seemed last week extraordinary measures here in Britain may not be enough. We will not hesitate to go further, writes Mr Johnson. From the government today came a shift in emphasis. Hunker down. The lockdown in Britain will not be over anytime soon. Michael Gove is Minister for the Cabinet Office.
I can't make an accurate prediction, but everyone, I think, does have to prepare for a significant period when these measures are still in place. But it's vitally important that at the moment and for weeks ahead that people maintain the strict social distancing guidelines that have been laid out.
Talking to Radio 4's Broadcasting House, Scotland's Chief Medical Officer Calderwood suggested just how long measures might need to be in place.
The modelling that's been done and that I have seen has always said that we need at least 13 weeks of some sort of measures in order to really get this virus away from spreading amongst people. When you have a shorter period of time, as I understand other countries have done, as soon as you lift the measures, the virus comes back again because we haven't stopped it transmitting amongst lots of people.
Across Europe, cities are deserted, streets silent, churches empty. On Friday, Ireland tightened its restrictions, bringing them into line with the UK. Spain has seen deaths and infections climb sharply. But Italy may see its situation begin to ease. Today, the Deputy Health Minister, Pierpaolo Sileri, told his country was at the top of the infection curve.
I believe that we are living in the peak of this epidemic. I believe in 1 week time, 10 days maximum, we will see a drop of positive cases.
Australia has brought in much the same kind of lockdown as Britain. South Korea is insisting on mandatory quarantine of 14 days for all overseas visitors. The world's largest city, Tokyo, has seen a spike in cases. The governor there has asked all 14 million residents to stay at home this weekend. But for scale, there is nothing to beat India.
Earlier this week, the world's largest democracy embarked on the world's largest lockdown. 1.3 billion people under curfew in an attempt to contain the spread of COVID-19.
The US is now the centre of the outbreak with more reported cases than any other country. 3.3 million people made fresh claims for unemployment insurance in the space of a week. As the individual states reacted, the federal government stepped up its response.
The president signed a historic $2.2 trillion emergency stimulus bill.
I've never signed anything with a T on it. I don't know if I can handle this one, Mitch. We can't chicken out at this point, can we?
Alongside that $2 trillion stimulus in the US has come some pretty vigorous debate about the balance to be struck between lockdowns to protect people's health and health services and the damage that might inflict on the economy. President Trump has said that the US should be opened up and raring to go by Easter. This isn't just about his re-election prospects. The chief economist of the World Food Programme has written that the economic consequences of the virus could be deadlier than the virus itself. There is only so long an economy can be locked down without inflicting lasting damage. Pippa Malmgren was Special Assistant for Economic Policy to President George W. Bush and sat on the National Economic Council.
The big variable is time. And I think most people can get their head around the idea that they might be in a lockdown for something between 2 and 4 weeks. But what they haven't really thought about or are uncomfortable with is the idea that it might last longer, or that we might even get into rolling lockdowns where you lift it and then you have to reimpose it again because hotspots start to develop. And so decisions about businesses are starting to be made that will have much longer term implications. And this means at some point there's a need to think about the very uncomfortable question, which is what's the balance between the cure and the consequences? And you can see businesses are already assuming that when they come back, they won't be retaining the people they had before.
There does appear to be a difference in the nature, of the debate between the US and Europe. Europe has very, very swiftly closed down its economy. The US seems much more careful about that. There does seem to be a more vigorous debate about the cost of shutting down society, the cost to the economy.
This is definitely so. And I think that the public are also different in the US than they are in Europe. I'm an American who's lived in Britain for a long time, and let's just say Americans don't have a queuing mentality. They don't fall into line when they're issued instructions. And so managing the American public is a very different thing than I think managing here. And remember, too, America is a much more litigious society where people sue over the slightest thing. I suspect that there's a good deal of concern about being sued for shutting down businesses.
This morning, we've had Michael Gove, the Minister for the Cabinet Office, talking about now a significant period of lockdown. We've had Catherine Calderwood, the Scottish Chief Medical Officer, talk about months, not weeks. How do you see the damage to the economy if that is the reality of lockdown?
Every day that goes by becomes trickier for the economy, a little bit harder to turn it back on. And I don't know where that day is where you can't turn it back on. And so you start to split the economy into really two kinds of responses. One is where you say, well, I don't know, but we'll allocate enough money to cover it. For example, I talked to a business yesterday, and they've already decided to cover their employees for the next 18 months. There are lots of businesses that don't have the capital to do that. So once they realize they've run out of capital, it doesn't matter whether it's 4 weeks or 12 weeks or longer. They don't have the money to last that long. And that is the question. How many can last that long?
Pippa Malmgren, former Special Assistant for Economic Policy to the US government. Well, Dr. Harlem Brundtland was Director General of the World Health Organization and was Prime Minister of Norway. She's co-chair of the World Health Organization and World Bank's Global Preparedness Monitoring Board. Late last year, that board published a report warning in stark terms about the world's lack of preparedness for a global pandemic. She joins me now. Good afternoon, Doctor.
Good afternoon.
You warned in that report that it was, and I quote, well past time to act, that the world is not prepared for a fast-moving respiratory pandemic, that the world is at acute risk. I'm sure it doesn't give you even a moment of pleasure that you were right, but from the work that you did, do you now draw lessons or a plan of action that the crisis is now upon us?
Well, first of all, of course, I would say what we have now is a warned catastrophe, because we saw that there was a big alarming gaps in the preparedness of the world, and we found compelling evidence that there is a very real threat of a rapidly moving, highly lethal pandemic of a respiratory pathogen, with the potential, as you have just been discussing, to kill tens of millions of people worldwide and wipe out nearly, around 5% of the global economy. And, a pandemic of this scale creates widespread havoc, instability, and insecurity. Those were the things we already wrote about, and we told the world and the leaders of the world the 7 action points that they needed to take. Now, I understand we are now there. It's already happened. So less than 3 months after our report, the coronavirus started spreading in China. And now the question is, both because of the health consequences, the health systems, the preparedness of the health workers, because there is not sufficient, support for them in their daily needs for protective equipment. There are not enough respirators. We know that the preparedness that we needed to have, and that was part of our action plans, they are not there in most societies across the world.
So are there things, forgive me, are there things that you can draw from your report that you would press upon governments or organisations to do now? Or frankly, is it too late for any of those lessons to have been put into place?
Well, it's certainly not too late.
Right.
However, we have to deal with the fact that we are already in this now, which means really putting a lot of emphasis on mobilizing quickly the funding and the attention, using the possibilities of each country to get the production of the needed equipment, even using, legal systems that are not in regular use, but in this kind of wartime time can be used to get quickly to the needs, to have the needs met. The other issue is to fund enormously people, it is their payments, to have money so that poor people and people who are now regularly workers but are put out of work, the way that the U.S. has done with its $2 trillion and that many other countries are doing, like the Scandinavian countries, filling the gaps, helping the businesses that don't have capital, as another speaker told us.
Okay.
Because you need to both look at the economic consequences and try to avoid a bigger catastrophe than what is necessary.
Do you believe that coordination of approach between countries, which is rather lacking at the moment, would be preferable?
It absolutely would, and it is, of course, partly happening. I mean, we have our global institutions, we have the World Health Organization strongly involved. It has to be funded quickly and totally, according to the needs, to help coordinate. And of course, the G7 and the G20 have both made commitments. This is something we are in together. The whole world has to mobilize and fund the necessary responses. And it is starting to happen. There is more coordination now than there was when this started.
Dr. Gro Brundtland, thank you for coming on The World This Weekend. Well, as we have heard, as we have experienced, the scale of change is breathtaking. Once again, big government, is in the driving seat. Envious eyes are sometimes being turned to more authoritarian regimes that appear to have had better luck at controlling outbreaks. Economic rules have been torn up. Precedent is no guide as to what might be done in the next week, the next day, the next few hours. What might be left standing? What might we learn? What might be constructed from the destruction? Margaret Macmillan is Professor of History at the University of Toronto. Neri Woods is the founding Dean of the Blavatnik School of Government at Oxford University and Professor of Global Economic Governance. They both join me now. Good afternoon.
Good afternoon.
Margaret, can I start with you? There is an undercurrent of criticism knocking around about the liberal democracies of the West and, as I said, rather envious eyes being turned towards more authoritarian regimes in the East. Do you think this has been a humbling moment for liberal democracies?
I think it has, and I think it's been a humbling moment for the West. We've tended to think here in the West that we set the pace and that we set the standards for the rest of the world, and we're now seeing something different. But I'm not sure that authoritarian regimes have all been all that successful with dealing with it. I mean, Brazil has a very authoritarian regime, and its response has been catastrophic. And I think it's too soon to tell which is going to be the best sort of response. And liberal democracies, when they set their minds to it, when the public comes around to thinking it, can act in very dramatic and authoritarian ways, as the two world wars have shown.
Mary, do you sense a shifting, I realise it's early days, but a shifting of the global tectonic plates? Do you think the world order is being reshaped in amongst the vast changes?
Yeah, but I don't think it's away from democracy. Democracies can do this really well. We know that from 1918. It's about getting prepared, acting early, acting fast. We can look at, 43 American cities were studied after the flu pandemic of 1918. Some of them, like St. Louis, acted really fast and contained it and were able to get back to business quite soon and have a lower peak and a slower onset. Others, like Philadelphia, did disastrously. And we're seeing that today. It's not South Korea, it's not authoritarianism that has led South Korea to be one of the most successful countries. It's that they did exactly what the World Health Organization has long prescribed, which is test, test, test right from the beginning. They created testing labs by mid-Feb. What's sad and depressing is that the way time has been lost in Britain and the United States. The Blavatnik School has just launched a COVID government response tracker. And what we can see there is that some countries, like South Korea, acting on all the historical evidence, have been right out there ahead of the curve. Others, China, Italy, France, have roughly stayed with the curve. So they've acted, but they could have acted faster and had a more successful time. Britain and the United States are the real worries because they're behind the curve in their reactions. So I think my point is this is not about democracy versus authoritarianism. This is about whether governments can act fast and which kind of expertise and science they abide by. And I think the simple lesson for Britain is, listen to the World Health Organization, listen to what successful countries are doing. Don't try and build a sophisticated model in the middle of a crisis and act as though Britain is somehow going to be completely different to other countries.
Margaret, in the introduction, you may have heard me saying that big government is back. The New Deal, the reconstruction effort of the 1930s in the US, and the Second World War itself changed the view of government for decades to come. Do you think that is automatically going to follow from big government this time around?
Oh, historians never like to say automatically, but
forgive me.
I think it's highly likely. I think there's been a move away anyway, even before this crisis and this catastrophe, from seeing government as the enemy, which it was in a number of democracies. But the tendency to see big government as inefficient and just wasting money and bloated. I think there was already pushback against that. But I think what this crisis is showing is just how important government it is, because you need government, both national and international, to coordinate a response to what is a national and international crisis. And so, yes, I do think that if anything good comes out of this, and I think some good things may well come out of it, it will be that we understand the importance of government. We understand the importance of something called the common good and shared common goods. And something that has clearly happened is that it has been possible for governments in about a week to spend money on a scale which most of them would have said was unthinkable 2 weeks ago. And so a lot of the arguments against spending money on social welfare, on things like the National Health Service, I think now simply will fall away because it has been shown to be done.
Nairi, in the report that Harlem Brundtland published last year, she wrote that trust in institutions is weakening. It's another point about the relationship between citizen and government. Do you think, again, that there will be a change following this?
There might be a resurgence in trust in government. I mean, to follow what Margaret was saying, during the Second World War in Britain, food was rationed. Instead of letting prices soar, the British government allocated strict measures of food to everyone in Britain. And the result on the poor was amazing. Rickets, which is a malnutrition disorder which affects child development, was pretty much eradicated because of wartime rationing. So that while the rich got to eat less, the poor actually got to eat more and eat better. And that's just one example of the way that suddenly the entry of government into every aspect of people's lives made people aware that, yes, governments can make mistakes, but also governments, particularly for the poorest and most vulnerable, can do extraordinary things. And that shifted the entire mindset. If you think about the 1930s, where governments, including here in Britain, simply left the working classes to be sort of unemployed and starve, the 1940s was a lesson about how government can transform the lives of everybody. And we might be living through that moment now as we watch government intervene in every part of our lives and across business to try to protect human welfare in a way that we certainly haven't seen in the last several decades.
Nairi Woods, Margaret Macmillan, we will leave it there. We will no doubt return to this. Thank you.